Hi, I'm Dr. Burkenstock, owner of Skin Body Health in New Orleans, Louisiana, and Mandeville, Louisiana, where our two clinics are located. We're also licensed in Alabama and Florida, so that we can personally visit you there when we're doing our beauty events, town halls, conventions, and personal beauty extravaganzas. Also, nationally, if you need us, we can certainly do a Zoom or a Facebook confidential evaluation for any of the services we may offer on hormones, weight loss by DNA, skin enhancement with skin DNA, or any of the other plethora of services that we offer, like anti-aging advice, health tips, prevention tips, to make sure that you're getting the most longevity and vitality out of your life. Tonight we're going to focus on hormones. Well, as we know, as we age, hormones decline. Did you know they actually start declining around the age of 35? When that happens, sort of the DHEA, which helps us to handle a lot of stress in life and keeps the hormones balanced, it starts to fall. And when it starts to fall, we don't handle stress as well. And we may almost that we get more irritated more easily, more moody more easily, or as men, believe it or not, they can sometimes get more moody in a different way. Maybe they get more teary-eyed at a show or a sad movie, or they just don't find when they need that strength to fight or flight out of a situation, it might not quite be there, they're kind of noticing, as it was before. We can also notice it in declining stamina. And some people know, but not all, that both men, of course, but yet women have testosterone. And we both need healthy amounts of testosterone, but for different reasons. So a man gets energy and vitality when his testosterone is up. They used to think that high testosterone was equivalent to anger. We now know that that's not true at all. Actually, their high testosterone gives them the strength and the stamina to keep their cool or to fight and flight if a dire situation would need it. It's when their testosterone is actually low that they can get irritable, angry, moody, and actually emotional and tearful. For women, when our testosterone begins to fall, we notice a big decrease in sexual desire and libido. Then we can also get some changes as far as strength, stamina, and just kind of that inability to get through a day. So testosterone does affect both sexes. Estrogen affects both sexes. That's where I normally get a highbrow from the guys. Yes, guys, you have estrogen too. Both males and females have E1, E2, and E3. So you don't have to remember all that, but just suffice it to say that E2 and E3, those two estrogens, are our workhorses. They're the ones that do good things around the body for men and women. Men just need a tiny amount. Women need a lot of E2 and E3. What neither sex needs is E1. So estrogen number 1, otherwise known as estrone, is the bad estrogen. It's the cancer-causing estrogen. We all make it, and as testosterone goes down in a male and he ages, his E1 or bad estrogen goes up. He can get some other estrogens going up as well, but the bad one is what interferes, and actually males can get breast cancer too. Estrogen number 1, E1, estrone in a woman is a risk, substantially risk for breast cancer. Doesn't mean you'll get breast cancer, but it is a small added risk. And for women, our E2 and E3, estradiol and estriol, the good guys, when they start going down as we hit perimenopause, that period of time when kind of we're getting more moody and periods are changing, our cycle may be becoming longer or shorter or more painful. When those things happen and we notice we're not sleeping as well at night, well, the sleep is directly related to our progesterone, another one of our famous hormones. But the E2 and E3, our workhorses, are what keeps the heart strong, the bone strong, the mood going, our curvy lines, and other things that keep a female being feminine. So when you hit perimenopause or menopause, you don't have to wait till the cycles are ended. If you come in and you're having symptoms, moodiness, libido issues, decreased sexual desire, can't sleep, insomnia, skin changes, dryness, waistline changes, all these different sort of things. We can test your hormones and we look at the whole hormone cascade. The worst thing we can do for you is slap on an estrogen patch or give you an old-fashioned estrogen pill that was made from horse's urine. Well, it's not so much that it was the horse's urine, it's not a nice thought, but that chemical or that compound, molecular-wise, in the horse or from the mare is E1. And if you remember what I said a few minutes ago, that E1, that estrone, is the cancer-causing estrogen. So we make enough of it ourselves as we get older that we don't want to make, that we made very little of when we were young. We certainly don't want to take something that has E1 in it, estrone, that increases that bad estrogen in our body. There's certainly arguments about hormones, and they're probably finished teasing it out at some point in the future. Suffice it to say, myself and my anti-aging colleagues, we believe in bioidentical or natural hormone creams. It's just a little tiny amount of cream that you apply every day. Yes, we make it for males too, but it would certainly be a way different custom formula, customized to each male. And for the female, a customized formula for them, because no two are alike. So we're not pulling anything off of a shelf. We're sending a customized formula but based on your blood work and symptoms, and we get those custom compounded so that they're directly beneficial to you. And we follow that with symptoms and blood work as time goes on to make sure that we're giving you your unique formulation that can put you at your very best. As I was saying, the hormones are a cascade. So it's not just an estrogen patch or testosterone capsule or progesterone at night. What it is a combination. So since we are like an orchestra, we've got DHEA, we've got SHBG, sex hormone binding globulin, we've got the 3 estrogens, E1, E2, E3, we've got progesterone, and we've got testosterone. So when we look at the combination of all those and we make formulas that have a little bit of each, a little where you need some, medium where you need others, and a lot where you need a lot, then we can balance that orchestra and make a beautiful music. Again, by slapping something on, and even a lot of people use the pellets, and if they are happy with the pellets, by all means, stay with them. They're not particularly my favorite. You do have to, implant them into the buttock, so you are making a mark every 3 months into the buttock, which eventually, I don't like marks, on my particular skin. Certainly, it's a put in and go. So for that part, it's easy, but you can't fit 6 or 7 different hormones into a pellet. Therefore, the doctor has to pick and choose, and you're not getting a custom formulation to get you back into that perfect circadian rhythm, that perfect cycle of hormones, to have you where you were in late teenager or early adulthood. That's when your body was singing that symphony, and that's where we bring you to. We're not surging testosterone for a man or a woman. We're not surging estrogen for a man or a woman, but we're giving you that nice circadian rhythm, that orchestra, where you look and you feel your very best. No longer do you walk into a room and go, what did I come in here for? Or searching for a name, You're able to pull it up more easily. Now, true in these most recent times, and we've had COVID, and COVID can cause some short-term memory loss, and we find that anywhere from 6 months to a year, some of that comes back. So I'm not directly relating it to that, but memory loss to any issue, the hormones usually help. It suffices to say, we know that women have a very, very low rate of heart disease and heart attacks when they're young. What we know is that is correlated to all the good flowing E2 and E3, estradiol and estriol, flowing in their system. So that's one of the reasons why males have always had an increased rate of heart attack, and they just don't have that E2 and E3, estradiol and E3, in these large amounts, and nor should they have. But for females, it does protect us, from those heart attacks. After menopause, when we're untreated, we have that same risk of heart attacks as a man. So then we become to be more like them. And That's not what we want to do. There may be some other causative factors, why women are having more heart attacks. Could be the job force and work and more stress and so on. But what we do know to be true is that women that are fertile before perimenopause and then menopause don't have the number of heart attacks as the gentlemen do. And estrogens also protect our bones, great for young looking skin, and so on and so forth. So when we replace these hormones, we get back the libido, we get back the strength. The skin remains smooth with as much elasticity as possible. Of course, you'll still age. You just won't age at that accelerated rate as you often do without your estrogen. Sleep, that's another topic. So the rage became, and actually I had one, to get your tubes tied. And we went through a period of time there where if you didn't want to take birth control pills, where I never liked medication, and vasectomy may or may not have been an option for your husband, and you were looking for something to stop more children, because you have a big enough family as I did, my OBGYN and I discussed a tubal ligation, which means getting your tubes tied so that you can no longer have children. So I did so. What they didn't know in the 90s, what they do know today, is that when we cut the tubes, the progesterone traveled through the fallopian tubes to the uterus, and that's what helped you go to sleep. So once the tubes were cut, and I told my OBGYN, could that be any correlation? Because I can't sleep. He said, I think it's because you got 3 little babies at home, and when they're all sleeping regular, you're going to sleep too. Well, that never did happen. And bless his heart, none of us, I was a physician then, none of us knew that correlation then. What we now know is that progesterone is vital to sleep quality. And if you're having sleep issues and you replace that progesterone and melatonin too, because melatonin is one of the sex hormones, you can take a very, very low dose, or if you opt to no dose at all. But that progesterone, with or without a little bit of melatonin, is like a sleep gem when you get to that perimenopause, menopause, and even the guys over in andropause, lots of them can't sleep too. Although many men do sleep like logs, I will admit. So when I'm talking about hormones, there are supplements that you can take to increase the adrenal gland, which controls sex hormones, increase libido through oxidation and the travel of blood flow, hormone balance, which works through the liver to detoxify and take away some of that bad E1 estrone. So there's 4 products that I recommend. Please remember, we have a YouTube channel, Dr. Burkenstock Skin Body Health. And whether it's this topic or hormones or some of our beauty topics, we did lips and fillers the last couple of weeks, anti-aging, weight loss, all of those topics can be found on our YouTube channel, Dr. Burkenstock Skin Body Health. Like and share our videos. It helps us to grow our population. We love to serve people. And if you do, you'll be entered into a drawing. The first 20 people will happily send you a bottle of Libido Lift. Libido Lift contains nutraceutical and herbal ingredients, no harsh medicines or chemicals, and it increases male and female sexual desire synergistically. It helps the adrenal gland to be balanced, and it's all through just natural vitamins and minerals. So it's a great itinerary to use without going on to some sort of chemical stimulation that a lot of times doesn't even work. If you missed any of our previous webinars, please remember Dr. Burkenstock Skin Body Health on YouTube. We're also on LinkedIn and TikTok. If you click in the description below, you can see our store link bio if you may be interested in any of our vitamins. Our vitamins are FDA approved and they're a top medical grade. So you know when you get our vitamins and supplements, you're buying something with quality and potency. So for hormone balance, I highly recommend for men and women, although I do have some specific vitamins geared toward men that are partially of these, but a couple have added on. We'll be talking specifically about male andropause in a couple of weeks, 2 Tuesdays from now. But for tonight, this is a general male and female. Most of it applies to both, although I'm primarily focusing on the female tonight. So in our hormone bundle, we have adrenal balance, libido lift, hormone detox. This is what takes out the bad estrogen, xenoestrogens, pollutions from the environment, detox it through the liver into the stool, and DHEA boost. So in our society today, we have so much stress and adrenaline going on. A lot of times we get caught in that fight or flight. Well, that really helped us in the caveman ages, but it doesn't suit us very well today. So our adrenal gland is constantly overworked. We're constantly pumping out cortisol, which leads to increase in stress, weight gain, and premature aging. So what can we do to slow that down? Well, in our adrenal balance, they have adaptogens. Adaptogens sounds like a big word, but if we break it down, it's pretty simple. Adaptogens tell our adrenal gland to adapt to what's going on. If you're slower and sluggish and your mood's going down, and you're getting low and depressed and you got no initiative, it says, hey, come on, let's pick it up. And rhodiola is one of the herbs that's in it, as well as ashwagandha. Those are the adaptogens. The adaptogens tell our adrenal gland, pick that up. Now, on the other hand, if your adrenal gland is running like a rat in a maze, and it's fight or flight, and you feel tired, and you feel wired, and you're so stressed out, and this the littlest thing, the doorbell rings, and whoever's behind that door better watch out, because when you answer the door, you're on fire. We don't want that to happen either, because that's going to give you adrenal fatigue and adrenal burnout. So the adaptogens, the rhodiola, the ashwagandha, all the tyrosine, which works through the thyroid gland, which works on norepinephrine, epinephrine, and dopamine, calms everything down, adapts you to that situation, and brings you back to a normal balance, pulls down the cortisol to normal levels, and the stress levels go down. DHEA boost, that's the next one I'd like to chat about for a minute. DHEA boost is the mother hormone to all the other hormones I mentioned tonight. Testosterone, progesterone, your 3 types of estrogen. So DHEA will turn on the elements in the ovaries and the testes and the adrenal glands to help you function and make more of the hormones you may be deficient in. So we're talking to your hormones in a very, very natural way. Libido lift, as we mentioned before, it works through the nitric oxide pathways. It increases blood flow, and that blood flow to your important organs is what stimulates a lot of your desire. Last but not least, hormone detox. We're all exposed to xenoestrogens and the processed meat, the processed foods, the pollution, the smog, and the E1 that we may be getting through chemicals, pesticides, or if we happen to have been prescribed one of those estrogens that I simply do not care for. That hormonal detox will take some of that bad stuff out, detox it through the liver, and put it in a stool. So I call this the Hormone Strong 4. It's the hormone bundle. It retails for $270. We've got this bundle specially priced for $219. So it's a $270 retail value, and we have a price, the hormone bundle, for $219. It's on our store, skinbodyhealth.com, in the product store. So if you'd like to visit there, we'll have it up there, and it'll be on sale throughout the rest of the year. So we do have a live testimonial tonight. It's one of our clients. We'll call her Client C, and she'd like to come on and just tell you what her success has been with hormones. Come on up, Miss Kathy. Thank you for coming. I certainly appreciate it.
You're very welcome.
So you've been on the hormone program now, I would think about 2 to 3 years. Is that correct?
Yes.
Okay. When you started, were you feeling some of the fatigue and moodiness, dryness in the vaginal or baby making area, and so on and so forth?
Yes, definitely.
Definitely. And did the hormones help some of that? How are you feeling?
Wonderful. Much better.
Oh, I'm so very glad. Is the program hard to do? Are the creams difficult to use?
Not at all.
Okay, good. Well, thank you for coming on today. I certainly appreciate it. I think when we hear from a live candidate that's actually using therapies that we recommend, it sort of gives you confidence that it could work for me too. Because it's easy for me to sit here and say, it works for me as a doctor. But when we hear clients say it's successful and beneficial for them, that brings it to a new level. So if there are any questions, we're happy to take them. You can always text us also at 985-727-7676. That is 985-727-7676. Our email is also on our website, and that email is a pretty simple one, info@skinbodyhealth.com. info@skinbodyhealth.com. So it's always a pleasure to serve you. If we can help you in any way, let us know. Are there any questions? Okay, so this is a pretty private conversation. A lot of people I've noticed want to do hormones like to send their questions after in a private messenger. That's fine too. We absolutely will address them. 2 weeks from today, we'll be doing specifically male hormones and how they can affect you as you get a little bit older with stamina, erectile function, and libido. So we'll see you, and thank you for listening.